Dr. Henry, you called them new and innovative, but a lot of people missed work, some of whom could ill afford to do so, to wait in line for a vaccine pop-up that they heard about through social media or text rumors. So some who waited didn't even get a vaccine. They're frustrated, disappointed, confused by these unannounced pop-up clinics. I mean, some of which didn't even check addresses to see if people were eligible. Ultimately, the buck stops with you, so I'd like to know, will you take responsibility and apologize for the vaccine free-for-all?
I'm not sure I would call it a vaccine free-for-all, but absolutely. We are concerned about the way they rolled out. These were done with the right intentions, that people were notified through means, and as you say, it got a life of its own that was not anticipated in social media in particular, and that made people do things. And, I do have to say, if you're not in those communities, do not go to those communities. You will get your vaccine, and there's enough vaccine coming in the next 2 months that everybody will get their turn. And the most efficient way to do it is to register, and you'll be notified as soon as your age category comes up, and you can book yourself into the clinic that will have your vaccine for you. But yes, there were some operational things that were done or not done that caused a lot of frustration, and I can see that, and I absolutely apologize to people for the miscommunications and for the confusion. That was certainly not the intent. The intent was to try and reach those people in those communities that we know have challenging times, and where there are barriers or there's challenges in getting access to people have not been registering. So those are directed at those communities, and we will be working with Fraser Health, as we do every day, to try and make it more smooth and better for people. But just to remind people, the main part of our program, where most of the vaccine is going, is primarily based on Pfizer, is the age-based program, and the easiest and simplest way to do that is to register either by phone or online, and you'll get your vaccine. And I will encourage everybody to support their communities to do that. And we will be doing additional initiatives in Surrey, in those communities where we know there's challenges, through community groups, through church groups, through gurdwaras and others in the coming weeks as well, to try and reach as many people as we can, as quickly as we can.
Penny, do you have a follow-up?
I do, and thank you very much, Dr. Henry, for that answer. I'm hearing that from experts that research from the U.S. points to vaccine hesitancy among racialized communities in particular, not actually being hesitancy, but more vaccine confusion, where and how to get vaccinated. Right now in BC, we've got an official provincial website. We've had pharmacies with their own system. We've had the rumor mill and vaccine hunter Twitter accounts that have people driving all over the place for these pop-ups. The vaccine rollout comes across as both confusing and confused. So I would just like to know how you're going to rebuild public trust after this, and in particular, address vaccine confusion.
Yeah, and vaccine confusion can be driven by many different things, as you mentioned. The people are spreading rumors, and the things that we are saying we have one provincial system. It was a transition early on. We had several different systems, and we've had different issues with vaccines, and that is a reality. The reality that we faced is the Moderna vaccine doesn't come in regularly. We're hopeful that that will change. The Pfizer vaccine had a period of time where it didn't come in at all for several weeks. We've had issues that we've had to investigate with the AstraZeneca vaccine that meant we had to change the worker program that was based on. So it is the reality that things change. And they change based on the information that we get, on the supply that we get. But right now, the most important, the mainstay of our system, and that has worked for over 1.5 million people already, is the age-based program, because we know that's the most important risk factor. And that will continue. And starting next week, we are confident we will have more vaccine. So it will make it seamless and easier for people in the next few weeks. And that every adult in British Columbia before our July long weekend is going to be eligible and be able to access vaccine. And so we need to all just regroup and know that there are many different ways that we're going to do this. We had to start off slowly with certain people who are at highest risk. We know in long-term care, for example, our elderly population, and I think that's the success that we see. In our elders and seniors, over 83% of people over the age of 70 in this province have been immunized. Those are the successes that we see, and that will be there for all of us as we go through these next few weeks. And I know there's many different reasons why certain communities, they find it difficult to go online perhaps, or there's a lot of people who have questions, and we're working at how do we connect with people to make sure that their questions are answered in their language, in a way that they understand. And we can always do better on that, and we'll be working on that, particularly as more vaccines arriving in the coming weeks and months.
So Dr. Bonnie Henry, you call these pop-up clinics innovative. So my question is, if they are effective, why not commit to improve the communications and outreach around them instead of apparently just shelving the idea for now?
Yeah, and that's what we've been talking about, and I talk with Dr. Lee and Dr. Elizabeth Brodkin in Fraser Health on a daily basis about, what were the things that worked and didn't work in those. So I'm not saying we're writing them off, but we are out of vaccine right now as well at this point in the week. So we will be looking at where are the things that worked and how did they work and how do we do better at it, and we'll be looking at that in the next little while. But hopefully, we made the point today that the best way to guarantee your spot and your vaccine is to register, and it'll be there for you. So you don't have to worry about whether there's a pop-up clinic in your community or not.
Jawad, do you have a follow-up?
I do, thank you. And I have many follow-up questions, but I think I'll go with this one. So what suggestion do you have for media in this case if we encounter such a pop-up clinic which is unannounced in near future? How do you want media to react to that? Do we just let it be, or let people know that there is one unannounced clinic in their area?
Yeah, so the way, and that's a very good question, and thank you for that. Some of the things that I saw happen were rumors being spread on social media, and sometimes that's not helpful. I know that Fraser Health was looking at getting it out in a community on a grassroots basis, and sometimes that goes crazy, and it reminds me how we are in a very, very connected world. So, yes, we would appreciate getting the message out that these types of clinics are targeted to specific people for a reason, and your help in getting to those people would be great, particularly people who speak languages other than English. We know that sometimes that can be a challenge in finding the information they need to be comfortable being immunized, so that's one of the things that we try and do. And to give the message to others, if you don't live in Newton, don't go to the clinic in Newton. It's designed for that community. We look at our cases by where people live. And so case rates that are high in a specific community reflect people who live in that community. And that's why we try and target the clinics to make it easy for people in those communities where we know there's a lot of transmission. And, we talk about in Surrey, for example, a lot of the communities are people who work in food processing or in your grocery store or healthcare workers and live in larger multi-generational families. So we need to reach out in ways that speak to those people to make sure they're comfortable and know how to access vaccines. So if you're not in that community, your community will be targeted perhaps in a different way, and there may be other ways that will reach out to you. So yes, we are trying to do things differently, trying to figure out what's the best way to reach people and provide them with the information they need to access vaccine and to get all their questions answered as well. And we'll continue to do that, and your help would be greatly appreciated.